Over 80% of adults in the US, UK, Canada, and Australia is experiencing serious back pain at some point in their lives. That's not a small number. That's most people watching this right now. If you woke up this morning with a stiff, aching back, this video is for you. I'm Dr. John, and I'm about to show you 7 targeted exercises for your lower back and the muscles that support it. Before we deep dive into the topic, you need to understand back pain usually comes from either weakness or tightness. The muscles around your spine either aren't strong enough or they've locked up from sitting too long, stress, or poor posture. This is because most of us spend 8, 9, or even 10 hours a day sitting on the chair or sofa. That compresses the spine, shortens your hip flexors, and slowly weakens your core. Over time, your back pays the price. Let's start with exercise number 1, the knee to chest stretch. This is one of the most effective moves for releasing pain in the lower back and decompressing the lumbar spine. Lie flat on your back, knees bent, feet flat on the floor. Let your arms rest at your sides. Using both hands, gently pull your right knee in toward your chest. Now tighten your abdominal muscles. Feel your lower back press into the mat. Hold this for 5 seconds. You should feel a gentle stretch in the lower back and the back of the hip. No pain, just a comfortable release. Breathe normally. Return to the start. Now do exactly same with your left knee and hold for 5 seconds. Again, go back to the starting position and pull your both knees together with your same technique. Repeat this sequence 2 to 3 times per session. Make a daily routine in the morning and in the evening if possible. Exercise 2 is the lower back rotational stretch. Rotation is one of the most neglected movements in spinal health. This exercise relieves tightness on both sides of the spine and helps restore natural mobility. Same starting position. Lying on your back, knees bent, and flat feet on the floor. This time, keep your shoulders firmly pressed into the floor. That's key. Don't let them lift. Slowly roll your bent knees to one side. Let gravity do the work. You'll feel a stretch through the opposite side of your lower back. Hold for 5 to 10 seconds. Slowly back to center. No rushing. Roll to the other side. Feel the stretch in the opposite lower back. Do it 2 to 3 times daily in the morning. It makes a remarkable difference in spinal mobility over time. Exercise 3 targets spinal flexibility, specifically the ability of your lower back to move freely in both directions. This is a subtle but incredibly important exercise that most people don't know. From the same starting position, tighten your belly muscles and let your lower back slowly rise away from the floor. Now flatten your back, pull your belly button toward the floor. You'll feel your lower back press down into the mat. That movement, arch and flatten, trains the muscles that control your lumbar curve. People with back pain often lose this range of motion. Getting it back is genuinely game-changing. Start with just 5 repetitions a day. Over the coming weeks, work up to 30. Do it on a daily basis. Consistency is the strength. This exercise directly targets your glutes, core, and the erector muscles along your spine. Lie on your back, knees bent, feet flat on the floor. Keep your head and shoulders completely relaxed. Arms by your sides. Tighten your core and glutes first. Then raise your hips until your body forms a straight line from your knees to shoulders. Hold this position long enough to take 3 controlled deep breaths. Then slowly lower it back to the floor. The most common mistake people make is pushing the hips too high and overarching the lower back. You want a straight plank from knees to shoulders, not a rainbow. Squeeze your glutes and keep your core engaged. Start with 5 reps per day. Each week, add a few more until you reach 30 reps per day. The stronger your posterior chain gets, the better your back feels. Exercise 5 is cat stretch, the move which physiotherapists have prescribed for decades. It mobilizes the entire spine from the neck to the sacrum. Think of it as an oil change for your back. Come onto your hands and knees. Wrists directly below your shoulders, knees directly below your hips. Start with a neutral, flat spine, not arched, not rounded, just natural. Slowly arch your back upward, your belly pulls up toward the ceiling, your chin drops toward your chest. Now slowly reverse, let your belly sink toward the floor and your head rise. Doing 3 to 5 reps twice a day can keep the discs hydrated and the facet joints moving. This exercise directly counters stiffness, and that's why physiotherapists recommend it for nearly every back condition. Exercise 6 is the seated rotational stretch, especially good for people who sit for a long time at work. Sit up straight on an armless chair or stool. Cross your right leg over your left. Sit tall, don't slouch. This is an active stretch. Brace your left elbow against the outside of your right knee and use it as leverage to rotate your torso to the right. Turn from the waist, not the neck. Hold for 10 seconds. The key here is to grow taller as you rotate. Imagine the top of your head reaching for the ceiling while your torso twists. That decompresses the spine while stretching. Return to center, switch your legs, and rotate to the other side. Hold for 10 seconds. Do it 3 to 5 times per side. Our final exercise is the shoulder blade squeeze. Before starting this exercise, you need to understand one thing. The upper back is directly connected with the lower back. When your upper back slumps, your lower back compensates. Sitting tall, pull your shoulder blades firmly together, as if you're trying to hold a pencil between them. Your chest opens and spine lengthens. Hold for 5 seconds and watch the posture shift. Now, lower back is compressed, head is forward, the load is on whole spine. Now, back your shoulder blades with chest open. Repeat it 3 to 5 times twice a day. This can be done standing or seated on your desk or stool. So let's put it all together. 7 exercises, 15 minutes daily. Here's exactly your daily exercise routine. Morning, knee to chest, 2 to 3 reps each position. Rotational stretch, 2 to 3 reps per side. Lower back flexibility, 5 reps. Bridge, 5 reps. Cat camel push-ups, 3 to 5 reps. Repeat it in the evening and you're done. It only takes hardly 15 minutes. Pro tip, week 1, focus on consistency, not reps. Weeks 2 and 3, gradually add repetitions. Remember, if you're already having chronic pain in your back, consult your physiotherapist before starting this exercise. It's because exercise is powerful, but it doesn't replace diagnosis. Know the difference. Here's what I want you to do. Do it right now. Don't wait until the pain gets worse. Tell me in the comments, how long have you been dealing with back pain? What have you tried? I read every comment and I do reply. This community is here to support each other. And subscribe if you want more evidence-based health content. Everything I cover here is grounded in real medicine. I'm Dr. John, and take care of your spine. See you in the next one.